Instructions for successful plastic surgery. On the day before surgery, we will give you a call to give you your arrival time and details. Please shower the night before or the morning of with an antibacterial, fragrance-free soap such as Dial. Wash your hair. Don't use any hair products, cream, deodorant, hairspray, perfume, or makeup. Remove all finger and toenail polish. And pay special attention to washing and cleaning your belly button. Shave areas you commonly shave, and any areas adjacent to the site of surgery, such as armpits for arm lift surgery, and pubic area for tummy tuck and body lift surgeries. Make sure to pack your bag for the day of surgery. Your bag should include any paperwork and ID that's requested, all prescription medications, warm cotton socks or compression socks, clothes that are easy to put on after surgery, hair tie, and whatever you think is essential. Confirm your route to and from surgery with a responsible adult who will drive you. Also, please confirm plans with your support person and make certain that he or she has all of your post-operative instructions. The evening before surgery, with dinner, please make sure to take one antibiotic pill and place the scopolamine patch behind your ear. Do not eat or drink anything past midnight the night before surgery or the morning before surgery. Anything more than a small amount of water is needed for brushing teeth or swallowing medication may result in the need to cancel surgery. This also includes candy, gum, or mints. Relax. Call our office with any unusual anxiety or concerns. We are here to help you. On the day of surgery, please do not wear any jewelry of any kind, contact lenses, hair clips, body piercings, eyelashes, or wigs. If there is something that you cannot remove, please let the admitting nurse know right away. When you wake up from your procedure, you will be in the recovery room and will be wearing a surgical bra, an abdominal binder, or ACE wraps, depending on what procedure you're having. You may also have drains. A few weeks after your surgery, we will advise you to order a garment to help reduce swelling, which we can assist you with picking out. Common websites are Mirena for garments and Amazon for abdominal binders and ACE wraps. Make sure you follow the sizing chart. Measure yourself before you order. Keep in mind, you will not utilize this garment for the first few weeks due to swelling, drains, and the dressings over the incision sites. Do not buy any garments that stop mid-abdomen as they can leave dents. For lower body surgery, a garment that goes to your ankles will prevent leg and ankle swelling. When you arrive home from surgery, you should begin taking your medications as prescribed. The first few days after surgery, you may need to take all pain medications around the clock so you don't have to catch up to the pain. Your pain medications are likely to be oxycodone, gabapentin, and Celebrex. You may also add Tylenol as long as you're not using Vicodin or Norco or Percocet as your narcotic because these already contain Tylenol. Please make sure not to exceed more than 4 grams of Tylenol per day. It is very important to keep your incisions dry and clean after surgery. Remove the dressings and replace them with clean dressings once to twice a day or whenever saturated. Replace ACE bandages, foams, abdominal binders, or a garment exactly as it was placed on you. Refer to slide 19 for medical supplies. Please remember that the drains are your friends and they will expedite your healing. Do not remove or cut them at home. You cannot shower until all drains are removed to prevent openings and infections, which is usually about 2 to 4 weeks after your surgery. Number the drains and keep a log of each time you empty your drain and how much is being emptied. Bring this to your follow-up appointments. You might leak around the hole the drain is coming out of, and this is okay, as we want the fluid to leave the body. You may be leaky after surgery, so place some towels or pads down where you will be recovering at home. If fluid remains inside of you after surgery, you will develop a seroma, or a pocket of fluid, that will cause discomfort and can become infected, and it definitely will need to be drained. Seromas can become long-term complications. Strip or milk drains every few hours. This is done to prevent small clots from blocking fluid flow. First, clean the drain site with an alcohol swab, then use the swab to milk the drain. Hold the tube securely at the skin site with one hand, and with the other hand, pinch the tubing between your thumb and index finger and apply firm pressure as you strip the tubing towards the bulb. If the tubing and the bulb come apart, wipe the ends with alcohol and reconnect. Close the bulb and maintain suction. Check that the bulb is always deflated or flat. Squeeze the bulb before capping it shut. You may change gauze around drain sites if they become saturated, and you may apply bacitracin ointment to the drained skin site to help with irritation. Just make sure to secure the drain to your clothing so that there is no tension on the drain. Please let us know if there is a marked increase in drain output. So, for example, double your usual flow, an increased warmth, redness, or tenderness around the incision site, or a change to a thick, white, odorous drainage. Normal drain color will start bright red, then it becomes watery red, and then watery yellow. Here's a video on JP Drain Care. You can use your fingers and an alcohol swab to easily strip the drain. Make sure to also clean the drain site with alcohol so bacteria doesn't get in through the hole. In order to prevent blood clots from forming in your calves, you should walk about 150 yards every few hours after surgery. You should begin walking the night you get home from surgery, even if it is around your house or just to the bathroom. When you're feeling up to it, you can walk further. If you've had a tummy tuck or a lower body lift, you will need to walk at a 45 to 60 degree angle for the first 2 to 3 weeks. Renting a walker will be very beneficial for you. Dr. Agha recommends light leg and ankle exercises to prevent blood clotting. These exercises involve movement of your legs and ankles while sitting or in bed for at least 5 minutes every hour. Activities. During the first week after surgery, you really want to avoid anything that will raise your blood pressure. This could cause bleeding at the operative site, which could result in a hematoma, also known as a collection of blood. Walking is really the safest exercise, especially during the first week. Stay away from exercises that directly stress the area of your surgery for a full 4 to 6 weeks. After this period, cardiovascular activities such as a stationary bicycle or brisk walking may be initiated. Running at this point may be premature. Avoid any sort of heavy lifting, contact sports, and jogging for up to 6 weeks. 6 weeks after your surgery, you'll be nearing your preoperative level. Avoid pulling at the surgical area to maximize healing and minimize scarring. During the early phase of healing, one must avoid irritation around the operative site as this can worsen swelling and cause fluid accumulation. This could cause problems with the incision, such as dehiscence, opening of the suture line, or widening of the scar. Even though the skin is closed, please understand that there is still healing taking place beneath the skin. Do not shower until you've been cleared to do so at a follow-up appointment. Showering too early may result in incisions opening or even an infection. If you have drains or openings, you cannot shower, but you can sponge bathe around the areas. Once you are cleared to take a shower, do not scrub incisions in the shower. Do not soak in any form of water either. After showering, pat all your incisions dry and replace your incision dressings and compression garments. We will be calling you daily for the first few days after your surgery to check on you and see how things are going. At that time, we will schedule your first post-operative appointment, which will be with our physician assistant, Chelsea, and/or with Dr. Agha. If you need a wound vac placed after a lower body lift, you must come into the office the day after surgery, unless you've hired luxury care nursing who can do this at home for you. We will see you anywhere from 1 to 5 days after surgery for your appointment. You may be required to send photos the first few days after surgery to ensure optimal circulation. If you have incisions around your nipple areola or have a sutured belly button, send photos with flash to Chelsea at plasticsurgerycal.com starting the morning after surgery. Please be sure that you have received a response back. It can take 4 to 6 weeks for swelling to subside. Mild, lingering swelling can last 3 to 6 months. Compression garments are the key to help preventing swelling. You may drive when driving does not cause pain. This usually occurs about 1 to 3 weeks depending on the type of surgery that you've had. It's not safe, though, to drive a car within 24 hours of taking pain medication, as your reflexes and alertness may be altered. It is very important that the surgical incisions are not subjected to excessive force, abrasion, or motion during the time of healing. Scarring. Every person's body is different, and many factors contribute to healing. Your scars will be firm and pink for about 6 weeks. Non-smokers and those who take enhanced recovery nutritional supplements on slides 8 and 9 have a better chance of rapid healing and thinner scarring. Expect to wait at least 9 months before your scars lighten in color and become as flat as the rest of your skin. Although they will never disappear completely, scars will not show under most clothing and even bathing suits. Emergencies. Some discomfort is expected following surgery, but please be sure to tell us if there's an increase in swelling, pain, redness, drainage, or bleeding in the surgical area. If you develop a temperature of more than 100.4, if you experience dizziness, nausea, or vomiting, or just a general ill feeling. If you experience shortness of breath, chest pains, or unusual heartbeats, seek medical attention immediately. Should any of these complications occur, you may require hospitalization and some additional treatment. DVT stands for deep vein thrombosis. This is a serious condition, and it can cause injury or death. DVT is the development of a blood clot in a deep vein, which typically occurs in the legs. These clots can move through the bloodstream and cause harm to the vital organs of the body. Patients that are taking certain medications or those with specific medical conditions may be at a higher risk for DVT. Medications that can alter normal blood clotting mechanisms, affect blood flow, or can cause blood vessel damage can lead to DVT. Physical immobility for an extended amount of time, such as after surgery or in airplanes, can also increase your risk of DVT. To prevent DVT, we prescribe heparin, which is a blood thinner. This is given to patients having long surgery or for those that are traveling from out of town. We will give you specific instructions regarding this medication. Slide 21 lists some conditions associated with an increased risk of DVT. Heparin injections. Here's a video with steps for drawing up the heparin and injecting it. You can draw up the entire 5,000 unit vial into a 1 cc syringe and inject the needle all the way into the skin so that it is in the fat layer. This begins the day after surgery, both morning and night, 12 hours apart, until you have completed the course. It is very common to get bruising and swelling to injection sites. Choose a different fatty area with each injection, avoiding areas near your surgical incisions. Symptoms of DVT. Symptoms may not occur every time when a DVT is formed. If it were to occur, the symptoms may include swelling, pain, and redness in your legs and calves. Difficulty breathing, fast heart rate, and severe chest pain indicate that the blood clot has moved to the lungs. If you are concerned, please make sure to go to an emergency room immediately. Reducing your risk of DVT. When DVT develops, it is often unknown. Therefore, the definite methods to prevent it are still uncertain. In order to reduce the risk of developing DVT, patients are advised to follow these guidelines. Make sure to walk about 100 yards every 3 hours with help. When you can, try to sit in a chair and attempt leg exercises as recommended below. Alter your position by stretching your legs and your feet. Leg exercises done every hour, such as ankle circles, knee lifts, lifting your knee to your chest, and pumping your feet will really help. Avoid crossing your legs at the knee and at the ankles. It is recommended to wear loose-fitting and comfortable clothing. Compression stockings are also highly recommended. Make sure to always keep yourself hydrated. Drink fluids such as water, Gatorade, and juice. Minimize your caffeine intake and alcohol intake. DVT Prevention Exercises. Exercises should not be done if they're causing you pain in your calves, and if you're not advised to continue with the exercises by your surgeon or physician. Pumping your feet. Point your toes and foot as high as you can while keeping your heels on the ground. Hold for 30 seconds, and then put both feet flat on the floor again. Next, lift your heels off of the floor while keeping the balls of your feet on the floor. Ankle circles. Put your foot in the air and draw a circle with your toes. Change directions and continue for 30 seconds. Put your foot down and raise the other foot and do the same. Knee lifts. Sit down and march your legs and contract each thigh muscle. Make sure you stay seated during this exercise. Do this for 30 seconds. Lifting your knee to your chest. Raise your left knee and bring it to your chest region. Hold this position for about 10 to 15 seconds. Then return your leg to the floor in a slow motion. Make sure to alternate your legs 10 times. Travel-related deep vein thrombosis. There's increasing evidence that immobilization in a car or in an airplane for long flights puts people at risk for deep vein thrombosis. There are a number of ways to reduce the risk of travel-related DVT. Always drink plenty of water to avoid dehydration. Try not to drink alcohol before or during the travel, as this can compound dehydration. Try to keep your thighs clear of the edge of your seat. Use footrests as far as possible. Take a brisk walk for half an hour before the travel. If being driven, stop every hour and walk for about 5 minutes throughout the travel. If you're on a flight, regularly go for a short walk to the restroom to keep your legs moving. Try a few simple exercises to keep your legs moving by rotating your ankles, pointing your heel and toe alternately, and lifting your knees while seated every half hour or so. Try and tense your leg muscles as regularly as possible throughout the travel. Wear elastic compression stockings designed to reduce the risk of DVT. These are readily available in most pharmacies and on Amazon. The day before traveling back home, make sure to take a low dose of aspirin during the travel and for about 3 days following your travel. Incision and suture line care. Suture removal. Most of your sutures are placed internally and they will absorb over the course of about 2 to 6 months. However, a few stitches may be placed externally, especially with facial procedures. External sutures are removed anywhere from 6 days to 2 weeks after your surgery. Once your incision lines have closed at about 2 weeks, you may want to apply a skin moisturizer to the suture line. This helps in softening the scar and may alleviate any itching or irritation in the surgically treated area. Please choose something fragrance-free and free of glycolic, retinoid, or other possibly irritating ingredients. Vitamin E oil and petroleum jelly are acceptable alternatives. Slides 36 through 38 have more details on scar therapy. Once all scabs have healed and you don't have any openings, which is usually around 5 weeks, you may begin scar therapy. We recommend the following products. You can also purchase scar recovery gel in our office. About 2 months following your surgery, you may begin CO2 scar therapy in our office. This will help improve the texture of your scar. Please let us know if you are interested, and we will provide you with more information. In the 12 months following your surgery, you must wear a waterproof sunscreen with at least an SPF of 30 at all times in the surgically treated area, including the suture line. This is imperative, at least 30 minutes before any prolonged sun exposure. Protective clothing and a wide-brimmed hat for facial incision lines are highly recommended. New scars are extremely sensitive to sunlight, and if unprotected, can result in permanent changes in scar color to either a darker, lighter, or discolored shade. Rarely, a scar will take a nodular, bumpy, raised or thickened appearance. The scar formation may be hypertrophic or a keloid. If this should happen, please contact our office as soon as possible. There are medications that may be effective to flatten and improve the scar as it is forming. Thank you for completing this educational presentation. If you have any other questions, please note them for your in-office preoperative appointment.